So we have Dr. Behnam Cohen here today with us to answer any and all of your questions regarding dental health, any cosmetic procedures. So we're so excited to do this and to be able to give value from his expertise. So Dr. Cohen, how are you doing today?
Good morning, Dr. Negin. Good to be with you. I appreciate the opportunity.
Yeah, no, we are very we're very humbled to have you. And it's nice to do something like this because we always get random questions, outside of our scope of practice of physical therapy. So it's good to be able to take those questions that we get and to pass them to the right person.
I'm looking forward to it.
Yeah, great. Okay. So first off, if you could just introduce yourself, not that people don't know you, but just to give a nice introduction and what you do and what type of service you provide for your clients.
Good question. I appreciate it. Good morning, everyone. I'm a general practitioner. I do general dentistry, cosmetic dentistry, and implant dentistry. I've been practicing for the past 28 years. I have an office in Queens and I have an office in Great Neck, 23 Bond Street. I pretty much do everything as far as dentistry is concerned, with concentration of full mouth rehabilitation and dental implants, both placement and prosthetics.
Nice, very good. So do you see people of all ages for the most part? Because it sounds like you cover a whole lot.
Pretty much we could cover everybody. I concentrate on mostly adults with missing teeth and so on and so forth. But as far as the kids are concerned, I always say if they behave in the chair, we see them. But that's contingent upon the behavior. Yes. Nice.
Okay, very good. And actually, this is a question that we get all the time. And I think us, moms always talk about what is an appropriate age to first bring your child to see a dentist?
Great question. I get that question often, actually. Usually at the age of 2, when the teeth are about to erupt, to come into the mouth, is a good idea to go ahead and do a checkup to see and make sure everything is okay. Obviously, for a 2-year-old, there are no x-rays or no extensive treatment. This is just to make sure that the parents are on the right track and preventing any baby bottle syndrome or any habits that could form to damage the future teeth. So at the age of 2 should be the appropriate first exam.
So if I heard you correctly, it's before the teeth or just as they're erupting?
Just as they're erupting. At the age of 2 is appropriate. Anything before that, even though they get some baby teeth, the kids are too young to sit in the chair.
And then you mentioned bottle syndrome. What was that?
Baby bottle syndrome. Baby bottle syndrome is basically when there is sugar inside the baby's mouth and it ruins the teeth. Oh. Unfortunately, some parents do not know that they have to wipe the teeth after breastfeeding or feeding with milk or juice or what have you. And that neglect, unfortunately, causes a lot of cavities in many cases.
Oh, wow. Okay. Interesting. That's really good to know, especially having some young kids myself. So what do you find most of your clients could have done better or could have prevented when they come in to see you?
Good question. Preventive. That's the name of the game. Do a good job as far as oral hygiene is concerned. Brushing, flossing, taking care of yourself at night, after each meal, so on and so forth. And also regular, every 6 months, seeing your dentist. Basically, that's the name of the game.
Okay.
Maintenance and home care, hygiene.
Makes sense. Got it. That's it's funny that you talk about prevention because on our end we see way more of we treat when the injuries develop, and hopefully we can all kind of push and get insurance to cover more preventative care, not just in like with radiology testing and annual checkups, but in our field as well. So that's
I agree with you 100%, but insurance companies have their own agendas.
Yeah, that is true. let's see, so with the preventative tips, are you finding people are not like flossing enough? They're not coming in to see you enough? Um,
It's a combination of both, I believe. Each person has a different story, especially with the COVID in the past year and a half. People have been afraid of coming out of their houses. So, but now they are slowly beginning to take care of themselves. Oral hygiene, some people, they're spending a lot of time at night staying up, but when they get exhausted, they forget to brush, floss, and so on and so forth. It's a combination of different factors involved that comes together to guarantee to some degree healthy teeth and healthy oral mouth.
Got it. Makes sense. Um, Sometimes when I prescribe exercises for some of our patients, I always say, make it a routine, make it a part of your everyday thing, like brushing your teeth, because people generally, I don't think, but maybe I'm wrong, don't neglect brushing their teeth. But in some instances, I guess they do.
Do you have any, let me ask you something. Do you have any kind of regimen for people for their TMJ if they have some issues to prevent it?
Sure. Yeah, sure. So we first off give a lot of education. They already know a good amount because they've seen someone like yourself and maybe a specialist of it. They might even have the night guards that has been made for them. So they are a little bit more aware. And obviously, if something hurts, they avoid it. Like certain foods that is like tough to chew and hard to, you have to open your mouth up wide. Like usually I always ask about, is it hard to bite an apple, things like that. And we always talk about how to put your jaw joints in a really optimal resting position. So we talk about that a whole lot. We go over how to stretch the muscles around the face, even because there's so much of that guarding and spasm of especially the muscles of mastication. So, right here and then internally where you can access a little bit more of the pterygoids. But we talk about that. We even teach them self-massage, around the muscles and then even around the joint up at the top here. So we give a lot of education and a lot of, self-help techniques. And then we do our own stuff in mobilizing and reducing muscle spasm and things of that nature. So,
yeah, I see more and more people having bruxism, which is the grinding of the teeth in the past many years.
oh wow,
I've been practicing for 28 years, but in the past, I would say 10 years or so,
yeah,
I'm seeing such an epidemic of grinding and bruxism, which is grinding teeth involuntarily. Usually it happens at night. So a lot of people have that issue and it has to be addressed in a broader sense. You mentioned something about night guards. I recommend night guards a lot, and patients seem to be responding positively to that. Some people still resist because they have something in their mouth during the course of the night to wear it. But that's something that they have to get used to. And for the most part, most people get used to it. And then they see the benefits of it. The benefits of the night guard and teeth forcing against teeth is tremendously bad for the teeth. So I'm glad that we touched up on that.
Yeah, definitely. Do you have any, I guess, ideas or insight as to why there's been more rates of the bruxism or why you're seeing more of it? Is it stress related?
One of the main reasons it's associated with stress, and God bless nowadays, especially in large cities in New York, with the situation that we have, a lot of people have that. Unfortunately, it happens at night and patients have no control over it. Some people say, I'm going to go ahead and make sure that I'm not going to do bruxism tonight. It doesn't work that way. It's not something that you could set your mind and that night you don't, grind your teeth. But the main reason is basically mainly the stress. Of course, it could be the spasm of the muscles of the mastication, as you mentioned it before. It could be the muscles being actually hyperactive. It could be one of the reasons as well. Non-fitting restorations is another reason, such as old fillings, crowns, so on and so forth, that gives uneven bite It could be another reason for that. And then there are other issues such as the TMJ issue that could be the cause, or the grinding could be the cause of the TMJ. So it goes both ways. These are the different issues that needs to be addressed.
Okay.
Yeah.
All right. Thank you for letting us know about that. Because on our end, I don't know if patients tend to be a little resistant to PT when they have this stuff going on. It's almost for us a little similar to sometimes when we get vertigo patients. They're a little bit hesitant. They're a little bit more afraid. Like, what are they going to do with me? It's right near their face. It's right near their head. And so we have so many more sensory, so many more nerves in this area and in our hands that sometimes a small pain that you would have at your elbow is just so much more magnified in this area. And so we haven't noticed that's been there's been a higher incidence of bruxism. So it's good. Thank you for letting us know.
Sure.
And do you pick up on it right away when you look at the teeth surfaces? Like, you see it before you even have to ask them, correct?
Correct. In many cases, I could, by just looking at the pattern on the teeth, say that this person is doing bruxism, especially in extreme cases when they put a lot of pressure. The teeth are usually, completely abraded, completely worn down on the chewing surfaces. Also, there is going to be some kind of enamel erosion and breakage at the neck of the teeth. These are the telltale signs that the patient is doing some kind of occlusion, which is the bruxism, putting extreme pressures. So yes, we could tell from certain patterns on the teeth that the patient is doing bruxism, which is grinding teeth. Yeah.
Do most of the people that you inform that, hey, I see this going on, do they have any inclination that they're doing that, or
some people, believe it or not, actually know about it, and they say that, oh yeah, my spouse or my friend or my significant other, somebody tells me that at night I'm making noises with my teeth. Some people, if they're single or the spouse is sleeping or what have you, they say, yeah, in the middle of the night or in the morning, I get up and I have this clenching, burning sensation or pain around my ear, and I catch myself and I wake up and I see that I'm tense. So some people are fully aware of the fact that they're doing it. Some people could completely deny it and say, no, I'm fine. Nobody tells me that. But unfortunately, the fact remains that it's there.
Nice. So in checking up with you a little bit more often, like the 2 times a year, you can kind of pick up on a problem that may be starting without them realizing.
Correct. In some cases, yes, we could tell that the patient is prone to doing bruxism or is doing it, and we could go ahead and remedy that situation before it gets much worse than that. Yes.
Okay. All right. Yeah. Very good. Thank you so much for the insight.
Sure.
We have, let's see, a question here that says, are dental decay issues hereditary?
Good question. Is it hereditary in some cases? Yes, it could be. Our genes could give us some of the, habits, some of the issues that our parents had. However, just because our parents lost their teeth when they were young, it does not automatically condemn that person to losing their teeth, having cavities, and accepting the fact that, that's it. My parents lost their teeth when they were 36 years old. I'm going to lose my teeth. It does not work that way. So hereditary issues do exist. It is a fact, but it does not necessarily mean that it rules that person's oral habits and so on and so forth. There are preventive measures that could go ahead, and the longevity of the teeth are going to be much longer than what our parents had. And it's a combination of diet, habits such as oral hygiene, proper brushing, flossing, and habits that needs to be taken care of. Yeah.
Okay. All right. Makes sense. Are over-the-counter teeth whitening kits safe?
What do you mean by safe? Yes, they are safe. They're not going to damage your health. The worst they can do are the following. They might give you some hypersensitivity to the teeth, which is fine. It's reversible. All different types of whitening and bleaching does that potentially. That's one thing. The other thing that could possibly happen if they are not used properly, because there are trays involved and strips and all that stuff, if it gets on the gum, on the soft tissue, it might burn those areas. Again, those are reversible. It's just a nuisance for a couple of days of having burned gums. All of these things are reversible, but they do not damage in that sense.
Okay, that's good to know. That's
yeah.
How can you avoid bad breath?
Good question. It depends on the cause of bad breath. As far as dentistry is concerned, the collection of food and bacteria around the teeth, between the teeth, under the gum, around the tongue area, these areas are related to bad breath. They're associated with halitosis, as they are called. Proper fillings, crowns, bridges, and spacing between the teeth, and oral hygiene at home care could remedy that problem if it's dental and it has to do with the oral cavity. The other issue could be from inside, from our stomach, and that's a completely different thing. It's a GI tract problem, and it has to do with diets and other diseases that might happen, such as ulcers and all that. That's a different story. The physician is the one to actually be referred to. But as far as dentistry is concerned, oral hygiene and fitting, crowns, and fillings should do the job.
Okay, all right. Thank you.
Sure.
How can I straighten my teeth as an adult?
Yeah, good question. Sometimes adults say, I'm too old for straightening my teeth or getting braces or getting, Invisalign and so on and so forth. The fact remains that anybody could be eligible for it as long as the bone structure is fine, and that's fine. It's available to anybody nowadays. The age does not matter. It's okay. Yeah.
Okay, very good. And so is there, because I've been speaking into some friends, they do place it in the inner surface, right, of the teeth, some of the teeth straightening, like Invisalign.
You're talking about such as Invisalign, those
Right.
clear aligners. Yeah, they are made in a series of incremental, changing the positions of the teeth, and they usually go on top of the teeth and incrementally computer generated, they move the teeth in the right position. Correct.
Oh, wow. Okay.
Yeah.
And so when you have an Invisalign implanted, how often do you have to see your dentist? Or is it just kind of like you said, the computerized?
No, usually what happens is that those aligners are made in a series and each person may be different. Some people may need 15 aligners that is changed usually once a week or every 2 weeks. Okay. And some people may need 50 of them. It depends on the severity of the situation, how much they have to move the teeth into the right direction and how much problem they have. Usually every week to 2 weeks, they have to be changed. And depending on the discretion of the doctor, if they feel that they want to see and make sure that the patient is going to follow the instructions, they could change it every 6 weeks and coming and getting new aligners. So not all the 30 or 40 or 50 aligners are going to be given to the patient who may not be cooperating, and then all of a sudden they come back in a year and things have not gone exactly the correct way. So it is possible that they're going to get it in increments of 6 to 8 aligners to be followed by, incremental visits to the doctor.
Okay. All right. Thank you. Thank you. Let's see here. This question asks, what's the worst thing you can eat or drink for your teeth?
Sugar. Sugar is one of the worst things, probably, I would say. And it's obviously feeding the bacteria that causes bad breath, cavities, and so on and so forth. And it has to be removed. One of the examples I give to my patients is that you could have 2 pounds of chocolate in one shot in 2 minutes and gobble it down. It does not damage your teeth as much as one chocolate a day. Put it next to your teeth and suck on it for half an hour. That one chocolate for half an hour, sucking on it inside your mouth, is going to give you and do more damage and give you cavities as
Okay.
opposed to that pound of chocolate. Basically, sugar is one of the worst things. And of course, there are other things. Alcohol is not very good for the oral cavity, but
Okay.
as far if it's related to cavities, sugar is one of the worst.
Okay. I have a follow-up question to what you just said. So is it almost worse to, and if we think of people that eat more candy, it tends to be more children. So is it worse to have like jelly beans because it can get stuck and chewy things versus like what you were saying before, something that just gets totally ingested and then is in your digestive tract, correct?
Correct. If something sticks and stays in the oral cavity next to the teeth for a longer period of time, that gives more opportunity for the bacteria to be fed by the sugar and cause cavity, gum disease, and so on and so forth. So it's a matter of using any kind of sugar, quickly brush.
Okay,
If you
got
have
it.
to.
If you can't brush, is just like swirling water in your mouth, like say you're at work, you ate something sweet, would that help? Or
Well, it doesn't do the same thing, but it's
okay,
better than nothing.
okay,
A
okay,
quick rinse and maybe the finger thing if
okay,
the brush is not available or the flossing
right.
is not available, but it's better than nothing. Of course, it removes some of the sugary stuff, around the mouth or food particles. Yes, to some
Okay,
degree.
great to know. Sorry, I keep bringing this back to kids and moms, but that was really interesting to know because we don't think about those things sometimes when we give our kids, a sweet treat. So anything that can sit there, get stuck on the surface of the teeth, something chewy, we should opt for something that can easily be swallowed and,
That
versus-
definitely helps a lot.
okay.
The amount
all
of
right.
the amount of sugar in the food or candy or what have you, and also how long it's going to stay in the oral cavity. It has to do with that. Yes.
Okay, very good. Thank you so much for that.
Sure.
My teeth feel fine. Do I still need to see a dentist?
Oh, Lord. Yes, good question. Absolutely. It is imperative that people get regular checkups and cleanings and so on and so forth. Just because somebody does not have pain or any symptoms, it does not necessarily mean that everything is okay. That's why we do the checkup, the physical blood work and all that stuff, not because we have issues, but it's to prevent issues from developing to becoming bigger issues.
Sure.
So the cavities that are small and can be caught in an X-ray, if you don't see the dentist in a year or two, they're going to wind up as a root canal. So it's going to be imperative to do that regardless.
And in the long run, you would also save money because a root canal.
Absolutely, that's the result of it. A little bit of preventive measure goes a long way for future. Yeah.
Okay. All right. Very good. Which is better, a manual or an electric toothbrush?
Good question. They're both good. One is not superior in any way other than efficiency. The electric toothbrush is obviously more efficient. The operative word is using it correctly. If they are both used correctly, they are perfectly fine. There is nothing wrong with both of them. They're fine.
Okay.
Just the electric brush is a little bit more efficient. That's all.
Got it. Okay. Very good. I catch myself clenching and grinding. So this goes back to what we were discussing earlier, the bruxism. How can I stop this habit? I think you already probably answered this, but if you want to give a nice synopsis of probably come to see you, correct? That's step one.
Usually the patient cannot control when they go to sleep, how the muscles and how the teeth and all that stuff is going to work. It is not something that the person has any control over.
Got it.
Okay, it's impossible to control yourself and your grinding at night. The night guard is the answer. It has to be worn at night. Yeah.
Okay, very good.
Incidentally, let me add something to that. Some people even clench during the day. It doesn't happen only at night. So some people are fully aware of the fact that they're grinding or clenching while they are behind the computer, reading a book, cooking, or what have you. Those people also need some sort of night guard to make sure that the teeth are not going to be grinding or clenching against the teeth.
Okay.
That's very crucial. Yes.
So the difference would be during the day they're awake, they can kind of prevent that, or do they also need to put something in?
They need to put something in. They're probably more aware of it because they're awake, but it's a habit that many people cannot break, and they have to have that night guard to prevent the damage caused by the clenching.
Okay, all right, very good. So I think we went over this question already. It asks, how does a dentist treat TMJ issues?
Good question. I personally do not deal with TMJ. I can diagnose it and send it to people like you or a dentist who specializes in TMJ.
Mhm.
As far as the TMJ, I could give them some ideas as to what to do, what not to do. And I believe you highlighted a few of those in the past. It's a good idea to go ahead and do not do habits that require repeated motions, such as chewing gum.
Mhm.
Some people for 3, 4, 5 hours a day, they chew gum. Anything that causes the TMJ, which is the joint right in front of your ears, to go up and down constantly, the repetitive motion, it has to be avoided.
Okay.
Other habits that needs to be broken is using your hand under your chin,
Ah,
watching TV, going like this to sleep, or
Yeah.
talking, or behind the computer. Basically, what I tell to my patients is that hands below the neck, don't
Got it.
touch your chin. So these are the habits that needs to be broken, and I could give them some ideas. But if there is an issue such as the cartilage inside the TMJ has issues, that's a totally different story. That's a totally different story.
Off the top of your head, do you know, like, of all the people who have TMJ issues, who requires surgery or who has that, articular disc cartilage problem? Is it
Basically,
smaller?
basically in my office, we start with the night guard. I offer them the night guard, which is the least expensive and also the very basic. So
Mhm,
it prevents from grinding and getting the situation even worse.
mhm.
And then if this one does not help, then we go to the next step and the next step. People who have those articular disc and issues that is worn down, it has to be surgically, intervention. It's not something that the night guard would help even.
Okay.
It may relieve the pressure to some degree, but it has to be surgically remedied.
Okay, all right, very good. Let's see. I guess I know we spoke about TMJ a lot, but do you mind telling us what it is, or TMJ dysfunction, and what some of the symptoms of it are?
Sure. TMJ or TMD that are synonymous, temporomandibular joint or temporomandibular dysfunction, is the joint that actually connects the lower jaw to the skull, and basically the lower jaw that goes up and down. There is a disc and a socket that actually work in each other, and there is some sort of lubricant around here that connects to the joint. And if that connection or that cartilage is damaged, it's very painful, and that's called the TMJ or TMD. That's the issue that needs to be remedied. And I'm sure you do the physical therapy for that as well. And it's
Yeah,
something that you have to deal with as well. Yes, go ahead.
yeah. So some symptoms that we are told by our patients are obviously jaw pain. Sometimes
Yeah.
it's associated with headache, because the muscle, Dr. Cohen mentioned before, we have a muscle right here. When you clench, you feel it kind of protrude under your fingers, right? Kind of in the temple area, or behind the temple area. So sometimes a headache association, even neck stiffness association, and just difficulty opening to maybe bite something. At times they can be painful talking, correct?
Correct.
And-
Everything that you just mentioned is the symptoms, the issues that arises from the TMJ issues. The headaches are very common, as you said, and it radiates right in front of the ear into the temporal muscle, into this area right around here. It could be also in this area and the neck, as you mentioned. It's painful, it's debilitating, and it needs to be remedied. And some people have it, unfortunately. Yes.
Okay. All right. Thank you, Dr. Cohen. Let's see. Are there any over-the-counter night guards that that people can use to alleviate this, or should they just come right to you and get something that you recommend?
Good question. Some people ask me, can I go to the pharmacy and get something, which is a piece of plastic? And usually what's involved is that putting it in hot water, boiling water, and molding it to your teeth. I don't believe it's a good thing. It may be a cheaper remedy, but it's not the right thing to do.
Okay.
The night guards, generally speaking, the ones that we make are custom made. They are basically made by the laboratory by giving them a mold, an impression of both upper and lower teeth. So the laboratory has the opportunity to make the night guard, which generally goes on the upper teeth. Patients wear it on the uppers. It's balanced, it's custom made to your teeth, and it gives you the correct bite so your upper and lower teeth come together in a proper fashion. So instead of exacerbating the problem, making the problem even worse, as opposed to the cheaper ones that you buy and you have to put in a hot water and it's hot and people say, I burned my fingers, and it throws the jaw to the sides and it causes even more problems. Generally speaking, it's a good idea. If somebody's on vacation and they have this issue and they forgot their night guard and they need something immediately for a few days, yes, that's possible to go ahead and use that one as a temporary. But generally speaking, the custom night guard is the proper way of doing it.
Okay. All right. Very good. Thank you for letting us know. That's important.
Sure.
We get similar questions about like foot inserts, but very important to know that, hey, don't just try to go and buy a night guard yourself at CVS. Come see someone like yourself first and let you get the right perfect fit for them.
To be honest with you, it's just a piece of plastic. It's a piece of plastic that is instructed for the patient to put it in hot water. So it's not the night guard until it becomes a night guard.
Got it.
By going through that process. So it's just a piece of malleable plastic that patients are purchasing in a box. And it does not do justice to the TMJ, unfortunately, in many cases.
So if we get someone in our office, maybe they've seen a dentist, but they don't have, they realize they grind, but they don't have a night guard, we should probably send them to you, correct?
That
The
would
sooner
be
the better.
That would be a good choice, yes. And the night guard is going to be made basically custom made to each individual person by taking impressions of the upper and lower teeth, correct?
Okay. All right. Very good. Thank you, Dr. Cohen.
Sure.
You've given us so many good tips so far.
Glad.
Let's see here. The next question, I think you already answered it. It basically just said, what are the benefits of a custom night guard? So I think you already answered that one.
Yeah. Should I repeat it?
It's up to you. I think.
No, I think we covered that one pretty good.
And the other one was, what is the process of making it? So I think
the process, very simple. The same impressions that we take for, let's say, in the dental office, uppers and lowers, it's a kind of soft material that we mix in a bowl and we put it in a tray. We place it inside the mouth. It takes about a minute for it to get set. We do the same thing for the lower and upper teeth. We send it to the laboratory and the laboratory makes the custom made based on the right way of bite that patients are biting. So everything is balanced. There is no additional pressure in one point or throwing the jaw to the sides or anything like that. Basically, these are the advantages and the processes. Yeah.
Okay, great. We had a question come in that asked, what is good for coffee stains on the teeth? You know, we all love our coffee.
Guilty as charged. Coffee stain. Probably the best thing to do is to quickly rinse with water right afterwards.
Okay.
The joy of coffee, I'm not going to take it away from anyone. I'm guilty of having it myself, a couple of them every day, but it's a good idea to go ahead and wash out any kind of residual coffee, not to give stain or not to get as much stain.
Got it. Okay, very good. Thank you so much. I think that's it for the questions that we've gotten. Is there anything that us physical therapists could do better for your clients?
Good question. nothing in particular comes to my mind as far as just educating them.
Mhm.
It may be one of the main things that I'm asking everybody, especially since I see so many people having this issue as far as the grinding, bruxism, clenching, and TMJ. Education, patient education. In my office, I personally, and I'm sure you do the same, I personally try to go ahead and have a one-on-one conversation and explanation with patients. I take the liberty of sitting down and talking to the patients and give them as much information so they could make a decision based on the information that they have. So one of the things is that just have a conversation and heart-to-heart talk with the
Nice.
patient. Yeah.
Very good. Very good. I think I saw that in one of the reviews about yourself, that you take the time and you really explain to your patients. So that's interesting that you just sort of brought it all together.
Oh yeah, it's I appreciate it. Yes, we take the time to talk to the patients.
Great. Thank you so much for all that you do. This was
appreciate it.
wonderful. I don't think we got any more questions in. Let's see. I'm gonna just do a quick little check on Instagram. Let's see. Yeah, no, that was great. I'm gonna do a quick little, once we end, I'm gonna just type in a quick little summary. It was really, really good. And if there's any way we can.
I have one question
Oh,
from
sure.
actually, I actually, it sounds like an old patient from the other office. I believe we touched up on it, and it says, at what age should children first see a dentist? As I just want to repeat it quickly, at the age of 2, usually it's a good idea to go to the dentist for a cursory evaluation of the teeth, the baby teeth that are coming out, and also mainly, obviously, for making sure that the habits that the parents have are not going to cause additional issues and cavities in the future. So at the age of 2 is generally speaking the right time, unless the baby has other issues that needs to go to the dentist even sooner. But generally speaking, at the age of 2 is the right age.
Okay, very good.
Sure.
All right. Well, thank you so much, Dr. Cohen. Thank you for your time. We know you're busy, but you gave us a lot of good, valuable pieces of helpful information today. So
thank you, Dr. Negin,
for that. And
thank you, Dr. Negin.
Yeah, yes,
I appreciate it, and I also want to ask people to take care of themselves, and also I appreciate your time and the opportunity that you gave me. Thank you.
Oh yes, of course. I hope to do this again. We'll do a part 2.
Sure.
Yeah.
Sure
Thank you so much. Well, have a wonderful day, everyone.
Thank you
for tuning in and watching us with Dr. Cohen. Thank you. Bye-bye.
Bye-bye.